Hi, I'm Dr. Melanie Palm from Art of Skin MD in Solana Beach, California, outside of San Diego, and we're going to be showing Dysport injections today. I'll do a couple little videos, just a short one showing treatment of what we call the angry 11s or the glabella areas, our medical term, and a little bit on the forehead. And then we'll do a second video that actually shows more interesting treatment around the eyes to treat the crow's feet, which are to the side of the eyes as well as underneath the eyes, and then also getting the bunny lines. So we're going to start with just sort of the upper third of the face. So I'm going to have this patient frown for me. And she's got really interesting muscle movement. She actually has a long procerus, this muscle that's right here. So you can see that sort of contracting and it raises it up. And then we're going to treat the little caterpillar muscles above the eyebrows, which are called your corrugators. So go ahead and frown for me again. Good, and relax. So I'm going to pinch this area and I'm going to stabilize with a little pinky on her nose, and we're going to do a little poke on 3. 1, 2, 3. I use a super tiny needle so that this is nice and comfy for patients. I don't like discomfort, and you want patients to have a good experience as they actually do it. And then go ahead and frown for me again and relax. We're going to get a little bit of that top tail of the procerus. So usually I just do 1 injection, but she's a little bit special, so she gets 2. And then go ahead and frown for me, and we're going to treat the lateral corrugators, that right side of her frown. So a little poke here. 1, 2, 3. And this patient's been really consistent with Botox and Dysport use over about the past 6 years, I would guess, maybe even a little bit longer, and that's why she's been able to look a lot younger than her actual age. All right, so we're done with that side. Now we're going to work on the left. Can you frown for me again? Good, and relax. So now we're going to grab this side, a little poke. 1, 2, 3. And then frown for me one last time. Good, and we're going to get those lateral fibers out here. 1, 2, 3. And then let's treat a little bit on the forehead. She doesn't need a ton. Can you raise your eyebrows for me? So our frontalis goes all the way over this forehead, and we're just going to pepper a little bit above. So relax for me. A little poke up here. In younger patients, you can usually get away with just doing sort of high injections that relax the entire forehead. We're going to do just a couple more on the side. It's really important that you don't give people those funny parentheses above the lateral part of the eyebrows here. So when I actually do the sides, we'll do a little poke here. And then I reserve a little bit, about a ½ centimeter or so above this brow. Raise up for me again so she doesn't get accentuation of this. So go ahead and relax. You can put a little bit of an amount so it doesn't actually affect things, but tames that down so you don't get that funny spot. And then turn towards me. We're going to do the same thing on the other side. Raise up for me again. So we're going to start high because she's got some muscle fibers here. And then raise up for me again, and we're going to tame that a little bit. Relax. All right, so we're done with upper third of the face. And that's it. If you've got questions, you can look at us up on the website, which is artofskinmd.com, or give us a call at 858-792-7546.